I'm glad to present here unexpectedly separated olive tip during John 2 TEVAR with iliac issue. This patient had a thoracic and abdominal aortic aneurysm with 6 mm sized small diameter iliac arteries. I made a plan. 2 stage the operation is better than 1 staging. At first staging, John 2 TEVAR with left Carotid-to-Subclavian bypass or TAA, and then a second staging EVAR. As you can see, right external iliac artery was too small, about the size of 6 mm. I did PTA and stenting with 10 mm stent. And I made an anastomosis of graft to the left common carotid artery. This is a schema of my John 2 TEVAR. I used a small-sized balloon through the graft for the accurate landing of TEVAR graft. TEVAR was done with easy. However, I felt some resistance while withdrawing the TEVAR graft at the iliac area, though not that serious. However, there was no olive tip. Nightmare began. I could find an olive tip in the Rundquist wire in aorta. Olive tip over the wire is more important. If so, we have some options to retrieve it. However, if the olive tip is out of wire, I don't want to imagine that. For safety, I snared out Rundquist wire to previous anatomosed carotid artery graft. First, I pushed the olive tip with a small-sized balloon inserted through the carotid graft with this downward direction, but failed, perhaps due to angulated artery and stent. There was no way. So I thought carotid graft could be another way to retrieve the olive tip. I pushed the olive tip with a small-sized balloon inserted through the right common femoral artery with this upward direction. Fortunately, I succeeded. This was the operative field, right common femoral sheath, and hemoshield graft to left common carotid artery. This was fractured olive tip. These are angiogram after empas plug embolization at left subclavian artery. These are completion angiograms which shows no endoleak and well-preserved right iliac artery. Thank you for your attention.